Hello there, thanks for joining us again today. Let me start as usual with the COVID update. An additional 101 positive cases were confirmed yesterday. That represents 1.1% of people newly tested yesterday, and the total number of cases now is 20,889. The full Health Board breakdown will be available as usual later on this afternoon, but my provisional information is that 53 of these cases are in the Greater Glasgow and Clyde Health Board area. I can also confirm that 259 patients are currently in hospital with confirmed COVID, which is one more than yesterday. You might have seen some media reports today suggesting that in comparison to other parts of the UK, hospital figures in Scotland currently overstate the numbers being treated for COVID. That's something we have been investigating for a few weeks. NHS boards have conducted an audit of the figures, and this audit is trying to identify which patients have tested positive within the last 14 or 28 days, how many of them are still being treated for COVID-related illnesses, and how many, although they might have tested positive for COVID some time ago, are now actually being treated for other conditions. I hope to be in a position to give an update on that next week once we've got the full outcome of that, and therefore at that point I'll be able to set out any changes we might be making to how we report hospital cases. In addition to the hospital cases, I can report that 4 people are in intensive care today, which is one fewer than yesterday. Unfortunately, I also have to report an additional death of a patient who had tested positive. However, this death actually occurred in mid-August, but Public Health Scotland have only now got all of the information required to report it. The number of deaths under the daily measurement is therefore now 2,496. That figure, which of course also includes the death that was reported yesterday, reminds us of the impact that this virus has had and indeed is still having on many people. And I want once again to say my condolences to everyone who has lost someone. I'm joined today by the Health Secretary, who will talk in a moment about care homes, and by the National Clinical Director, who will take questions with us. Before then, though, I've got 2 issues that I want to briefly update on. The first is that the Scottish Government will today publish our weekly report on the R number. You'll recall that the R number is the average number of people who we estimate would be infected by one other infectious person. That report will confirm what recent figures have probably already suggested to many of you. We think that the R number in Scotland increased last week, and that it is probably now above 1, perhaps as high as 1.4. Now, I've said recently that the R number is of slightly less concern when overall prevalence of the virus is low, and overall prevalence of the virus is still low in Scotland right now. But nevertheless, this is a further reminder that the virus is spreading again here, just as it is elsewhere in the UK, across Europe and indeed in the wider world. So it is a reminder of the need for us to take this seriously and do all of the right things. And that really relates to the first issue, or the other issue rather, I want to talk about today. And as I talk about this, I'll obviously make particular reference to the parts of the Greater Glasgow and Clyde Health Board area, Glasgow City, Western Bartonshire and East Renfrewshire, that have restrictions in place right now. But I want to reflect a little bit on how, as we come out of lockdown and cases inevitably rise, as we always predicted they would, how we nevertheless try to keep transmission under control, and what part Test and Protect plays in that. The really important role Test and Protect has to perform for us, but also what the limitations of that are, and the responsibility that still rests on the shoulders of each and every one of us. Now, you will recall that we tried to use the summer period, and did so effectively, to reduce COVID in Scotland to as low a level as possible. And that was because we knew that as we started to move out of lockdown, there would be more opportunities for the virus to spread. And as has happened in other countries, we may see cases begin to rise. But by getting it to low levels and trying to keep overall transmission as low as possible, what I've often referred to as our elimination strategy, we then give our Test and Protect teams the best possible chance of identifying local cases and clusters when they do occur, and through contact tracing and advising people to isolate where necessary, breaking the chains of transmission. And so far, our Test and Protect teams across the country are doing an excellent job, and I want to take the opportunity today to thank them for that. But the other crucial thing Test and Protect does, working of course with local incident management teams and local health protection teams, is give us much more intelligence than we had at an earlier stage in this pandemic about the causes and sources of outbreaks, and is able to make assessments of whether these outbreaks are contained or risking wider spread. And that intelligence then informs the decisions we have to take about when we need to take further action, impose restrictions, and what form that further action should take. So if you think back a couple of weeks to the outbreak that was identified in the Two Sisters food processing plant in Cooperangus, that outbreak was identified quickly as being sourced in the food processing plant, and it was identified before it had been able to spread more widely in the community. And that meant that measures could be targeted very, very specifically at workers of that factory and their households to try to make sure that it didn't spread any further beyond that. And that seems to have been successful, although of course that involved difficult periods of isolation for the workers and their households. But it meant that we were able to stem any spread into the community. And then a bit earlier than that, in Aberdeen, through Test and Protect and the work of the local teams, it was identified that the outbreak there had started in pubs, but also that there was a risk of wider community transmission. So we took the decision to close hospitality for a period and also impose travel and household restrictions. Those decisions were driven by our understanding of what was happening there in Aberdeen. And while all of that was really tough for people in Aberdeen and it took a while to bring the situation under control, it nevertheless has been effective, and that outbreak is now effectively over. In the last couple of weeks, the rise in new cases has been particularly pronounced in Greater Glasgow and Clyde. And as you know, earlier this week, we imposed restrictions on household gatherings in Glasgow City, East Renfrewshire and West Dunbartonshire. And what Test and Protect has been able to tell us so far in this situation is that the cases are not linked in the main to any big identified outbreak. They are instead associated with multiple smaller, unconnected, household-based clusters. And that then raises a concern about the risks of wider community transmission. And it was that analysis and intelligence that led us to the conclusion earlier this week that we had to take some action. Doing nothing was not an option. The question then became, what was the most targeted action we could take? And again, the information coming through Test and Protect guided us in the decisions we took, because the information was also telling us that at this stage, transmission appears to be largely household-based, as opposed to, as in Aberdeen, hospitality and pub-based. So that is what led to the decision to impose household restrictions but not close pubs, which I understand can be really counterintuitive and difficult for people to understand. So in short, what I'm trying to set out here is that the analysis we now get through Test and Protect enables us to be much more targeted and proportionate, rather than what we were faced with earlier in the year of simply imposing a blanket lockdown everywhere that really meant everybody had to stay at home. Now we try to be much more targeted, much more proportionate, but because these decisions are being guided by the analysis that has been done, hopefully these measures are effective. So in the Greater Glasgow and Clyde areas, we hope this targeted approach will work. But of course, we can't know that for sure, so we will review it again after a week to assess whether any further measures are necessary. Now, before I finish here, I want to address one further question, because some people watching and others might ask, why isn't Test and Protect stopping these outbreaks happening altogether? And we all wish there was some kind of magic bullet that would do that, because none of us want to live under these restrictions. But that leads me to a really fundamental point that I think it's important for all of us to understand, because it leads back to the responsibilities we all have. Test and Protect is, as you've probably gathered from what I've said today and what I've been saying up until now, it is a vital part of our approach now and for the foreseeable future. But test and protect is not the equivalent of a vaccine. It doesn't magically make COVID go away. What it does is step in these occasions when the virus gets past us. All of us who, when we follow all of the advice, are the first line of defence against it. Test and protect then works to contain spread, and it gives us information, as I've said, that allows us to be targeted when we have to impose restrictions. It is, if you like, our second line of defence. But we, all of us, we are the first line of defence, and we must do everything we can to stop it spreading in the first place, from person to person and household to household. And to put it bluntly, if we don't do our job, test and protect steps in, but it is by definition firefighting. And the more we let the virus through, the more we allow it to spread, the harder test and protect's job is to do. So what I want to say, and the point I want to conclude on, is that the situation in these parts of Greater Glasgow and Clyde, I really think should be a wake-up call for all of us. Numbers of new cases are high in those areas, and that's why we've had to impose some restrictions. But new cases have been increasing in many parts of Scotland in the last fortnight. So all of us, wherever we live, have to be more careful than ever about sticking to all of the rules and guidance and trying to minimise the chances that we're giving the virus to spread. We're never going to completely take away the risk of getting the virus. This is a highly infectious virus, and often it will spread, and that will be despite our best efforts to stop it. But all of us do have the opportunity and the power to reduce the risks that we face and protect ourselves and keep our families and communities safe. And the ways in which we do that are the simple, difficult to follow in practice, I know, but simple and very effective if we all abide by them, measures that are encapsulated in the facts advice. So let me just end with a reminder, as I always do, but if I can manage this, put even more force behind this reminder today, because it is so important that all of us stick to this. So remember to wear face coverings in enclosed spaces. Remember to avoid crowded places, indoors or outdoors. Remember to wash your hands regularly, clean hard surfaces after you touch them. Remember to keep a 2-metre distance from people in other households. And remember to self-isolate and book a test if you have symptoms of the virus. If all of us do all of these things, then we are minimising the chances of the virus hopping from one person to another and one household to another. We're reducing the number of cases and the number of clusters and the number of outbreaks that will spring up. And in doing that, we are making it more possible for test and protect to effectively contain the outbreaks that from time to time we know will inevitably happen. So I hope that's given you a bit of an insight into the decisions that we take, how those decisions are informed, and why sometimes we end up in positions that might, on the face of it, seem to be inconsistent, but they are driven by the evidence and the judgment that has been applied because we now have the resource of test and protect. But fundamentally, we all have to play our part in this if we're going to succeed, particularly as we go into the winter months, in keeping this virus under control. Thank you very much for listening. I'm going to hand over now to the Health Secretary, who's got some important information to impart about care homes, and then she and I and Jason will take questions as usual.
Thank you, First Minister. I have two updates I want to make today in relation to care homes. Firstly, in relation to Home Farm Care Home in Portree. I'm pleased to announce that the well-being of the current residents at Home Farm, which has been a priority for the Scottish Government, has been secured by NHS Highland, who are to purchase this care home from the current provider, HC1. You'll remember some of the background to this, I'm sure, at the end of April, and following a complaint to the Care Inspectorate, together with a notification of COVID-19 outbreak, NHS Highland undertook comprehensive testing at the home, which resulted in a significant, a significant number of residents and staff testing positive for the virus. The Care Inspectorate then undertook 2 inspections within a week of each other, and following the second of these concluded that the living circumstances and quality of care were such that they applied to the courts for an interim suspension order and emergency cancellation of the care home's registration under the powers that the Care Inspectorate have. NHS Highland had stepped in to provide significant levels of support to the care home to improve the standards of care and cleanliness and to look after the residents and safeguard their well-being. As a result, the circumstances of care were improved, delivered by a warm and caring local workforce under the leadership of NHS Highland. And in response to that improvement that was evidenced by continuing visits from the Care Inspectorate through July and August, the Care Inspectorate took the decision that the grounds for the emergency cancellation application no longer applied. But the long-term stability that ensures residents and staff is critical to us, and so we have worked closely with NHS Highland and the Care Inspectorate to secure this. Significant improvements have been made in the quality of care offered at Home Farm, with support from the Health Board, the Care Inspectorate, the local council, and of course the staff there. Improved infection prevention and control, use of PPE, training of staff, cleanliness of premises, and the maintenance of adequate staffing levels, all core elements to providing safe residential and nursing care to all the residents who are there. So NHS Highland has secured the purchase with £900,000 of additional funding from the Scottish Government. The transfer of the care home to NHS Highland will involve the transfer of the staff into the employment of the NHS with improved terms and conditions and, importantly, job security. And the future ownership of this home by NHS Highland also provides an assurance for people on the island that the provision of residential nursing care in their community will continue. The second update is that I'm pleased to say that today we are publishing new guidance to support adult care homes with the safe reopening of limited communal activities and with resuming visits by a range of health and social care professionals. This builds on the staged introduction of visits to care homes by family and friends, introduced in early July and again in August. And as before, this new introduction of support from health and social care professionals and limited communal activities applies to care homes that have been COVID-free for 28 days and are actively participating in the care home worker testing programme. So from the 7th of September, care homes who meet that criteria will work to resume routine face-to-face care from a wide range of health and social care professionals, including podiatrists, physiotherapists, optometrists, dentists, social workers, mental health and disability specialists. Of course, because of the unpredictability at times of community transmission of the virus, before resuming communal activities and enhanced visiting outlined in the guidance, care homes should update their risk assessments to include consideration of both. These will then be reviewed and approved by the local Director of Public Health. This is important to make sure that all the necessary steps are in place so that we can safely introduce this next step towards increasing normalisation of life for residents in our care homes. I hope that this provides both residents and their families, and importantly the staff in care homes, with a degree of reassurance that we continue to take careful consideration about how we can safely take the steps necessary to introduce a more normal life for the important residents in our care homes. Thank you.
Thanks very much, Jeane. I'll go straight to questions now. Lucy White from BBC Scotland.
Hi there. Just to ask, the Chief Executive of Aberdeen and Glasgow airports says there's more job losses now in the aviation industry than there were in the coal industry in the 80s. And he's offering to take on some of the burden, what he calls the burden of testing passengers that would reduce the quarantine period. So will we see testing of airport passengers anytime soon in Scotland?
Firstly, I absolutely understand and appreciate the damage that has been done to employment and sustainability in the aviation industry, and we want to work with the sector and, of course, given the nature of the challenges here, work with the UK government to try to address that as much as possible. as I've said before when asked this question, we continue to look at whether there are effective alternatives to quarantine, but we have to be very clear about the limitations in that. And just let me put it in simple terms, Jason may want to add to this. Because of what we know about the incubation period of this virus and the windows of opportunity that we know that testing is most effective, we can't always be sure that testing is picking up all positive cases. So if we test passengers, the day they fly into, for example, Edinburgh or Glasgow airport, just because the test is negative doesn't mean they don't have the virus, because they may still be in the incubation period, but at a stage that makes it unlikely that the test is going to pick it up. So if we then let everybody that had a negative test, sort of come into the country without the requirement for quarantine, we could well be seeding a very significant number of possible positive tests there. Now, there have been some suggestions about doing a test on day 1 and then doing another test, say, on day 8, but the person would still have to quarantine for that period, and then you might be able to shave some days off the 14 days. But you would still potentially be missing, because there's a sort of 14-day, broadly speaking, incubation period. So this is not about, for any ideological reason, preferring quarantine over testing. I want, in any aspect of this, and I've just been taking you through how we are managing to be more targeted and proportionate in the restrictions we impose. I want us to be as proportionate and targeted with the minimal impact in everything we do here. But we have to make sure it's effective, because there's no point if it's, there's no point in changing one system for another if that's then going to result in what we're actually trying to guard against. So we continue to look at these things. We continue, obviously, to have appropriate discussions with the UK government. But right now, I'm afraid the advice is clear that quarantine for 14 days is the most effective way of mitigating the risk of positive cases coming into the country. Do you want to add?
First Minister, you've covered the challenge of risk that we're trying to tackle. Every country in the world is struggling with this. I had a meeting with the airport owners and the airline industry earlier this week. It was constructive, it was open. I gave the public health view. They gave a view of, clearly from a different perspective, from the business and economy side of what they're doing. They also want to keep passengers and staff as safe as they possibly can. That dialogue will continue. I think science will potentially eventually help us out of this dilemma, and it will enable us to reduce the risk that we would be taking. But the present test and the present prevalence means that 14 days remains the safest. If you do something different, then that risk is going to increase. Then it will be a matter of how much of that risk decision makers are willing to take. But as things stand, remember, lots of countries don't have to quarantine. Some countries do. And that's because of the gradient of risk between those countries and ours. And the public health advice today remains that that is the safest thing to do. That doesn't mean that the dialogue shouldn't continue, and we shouldn't try to find a new way of doing that.
Thanks. Ewan Petrie from STV.
Thank you very much, First Minister. We've now seen the first transmission of coronavirus within schools. Unions have described the lack of physical distancing reported in schools as a major worry, and some teachers have been saying it's a case of when and not if this happened. So are you satisfied the current guidelines are enough to mitigate the risk to staff and pupils?
I'll hand over to Jason pretty quickly. I don't think it is yet the case that we can definitively say that there has been transmission within schools, but I'll hand over to Jason on that point. We have never tried to claim that we won't have instances of transmission within schools, and the guidance that is in place is designed as effectively as possible to mitigate against that. We keep that under review, and we will continue to keep that under review. We have, since schools went back, already changed the guidance on face coverings, so this will be an ongoing dynamic process. The two final points I would make very briefly, and as I say, I hope I never sound complacent on any aspect of this, because I am not. But we know two things about younger people. We've done a significant number of tests since schools went back amongst the younger age group. A very, very, very small proportion of them, well under 1%, have been positive tests. And we know, although again there's absolutely no cause for complacency, that younger people, when they get the virus, tend not to have the same burden of illness that some older people can have. So none of that is leading us to not take this very seriously. We will continue to keep all of the guidance under review, but I think it is an important contextual set of comments to put around that. But on the specific issue of transmission, I'll hand over to Jason, who might be able to elucidate a bit more.
The truth is there are positive cases within teachers, staff and pupils in schools. It's quite difficult to be absolutely certain where those positive cases came from. Test and Protect works in schools like it works in factories or office buildings or in households or indoor hospitality. It finds the positive case, it interviews that positive case personally, person to person. They ask where you've been, who have you been with, and then Test and Protect isolates the contacts. I have said I expect transmission to happen in schools. We've never said anything different. Everything we're doing is to minimise that transmission in schools, just as it is in the rest of society. Test and Protect will find those cases, it will stop the chains of transmission, and it may be that a few kids or a few teachers, or maybe a class at a time, will have to be isolated. We hope, it's not impossible that a school would have to close, we hope that would be kept to an absolute minimum. I don't think it's such an important moment, and I'm not wishing to downplay it, for the first time we have school transmission. That doesn't feel as important to me as finding each of the positive cases, finding out where the chains of transmission are, and interrupting them.
Peter McMahon from ITV Border.
Thank you very much, First Minister. First Minister, on the 19th of June, when you were announcing following further relaxation of the measures to combat coronavirus, you said, and I quote, "The virus hasn't gone away, but there's no doubt the virus in Scotland is now firmly in retreat. If we all keep doing the right thing, I'm more optimistic than I've been for a long time that we're now firmly on track to getting normality back into our lives." Do you think that was a bit over-optimistic, or are we on track for getting normality back into our lives?
I don't think it was particularly overly or under-optimistic. That, at the time it was true, the virus was in retreat. The virus is still at very low levels of prevalence in Scotland, although cases have been rising again. And, compared to the situation on whatever date it was you quoted me from there, I think you said the 19th of June, there is a lot more normality back into our lives. But what I have said consistently all along is that this is not a situation where the normality comes back and we all just forget about coronavirus and get on with the lives we had before the pandemic struck. This is an infectious virus that is still out there. It's probably running into the thousands of times I've stood here and said COVID is still out there. So it still takes a really conscious effort on the part of all of us to keep transmission as low as possible and to keep it under control. And what I've also said repeatedly is the less we rely on a blanket lockdown to do that, the more we have to rely on other things. And the more that comes down to hand washing, face coverings, 2 metres distancing. In a sense, when we were all being told just to stay at home all of the time, the virus has, fewer opportunities to spread. We locked ourselves down and we locked it down with us. As we go out and about a bit more, we have to find different ways of keeping it under control. And inevitably, it has more opportunities to spread. So we see cases rising. So this is not, and, we have more normality back in our life, but we have to work harder to keep that normality back in our life. This is going to be, potentially a long haul. We all hope, as Jason's just said, that science is going to come in and offer the more definitive solutions to this. But until that time, we all have to fight this battle on a daily basis. And we're fighting it in different ways now than we were when lockdown was much, much more restrictive. So I think that's pretty consistent, and it has always been consistent. The thing that we are not sure about at the moment is, as we go into winter, whether a seasonal effect is going to lead to a much more pronounced wave of this, or whether it will still be spikes and resurgences of the wave we've been living through that we can keep under control. And all countries are grappling with that, trying to understand that, trying to sort of predict that and prepare for that. But right now, the virus is there. It's not gone away. It's not going away. And therefore, since we're out and about a bit more, we have to do different things to keep it under control. It's as simple as that, or I can put it as simply as that. It's not as simple as that, and all of us remembering to do that all of the time, but we have to. Otherwise, as we see, it will take a grip again. It's going to take every opportunity we give it, so we have to just make sure we don't give it the opportunities. Do you want to say a bit more?
The only other thing that came to me as you were talking and from the question was that let's remember the global pandemic is accelerating. It is getting bigger. Every weekend, the WHO say we've broken a new record for the number of infections and the number of deaths. This is not something to be trifled with. Europe, in the main, has done well in recent months, and Scotland has been in that pack. We locked down, as the First Minister said. That was the treatment. Now the treatment is a bit more like whack-a-mole to try and find those outbreaks and deal with them. But the only things we have are human behaviour and test and protect. That's all we've got until science or the virus get us out the other end of it.
And there's going to be a degree of uncertainty and changeability in this. If you take obviously we've been very focused on the situation in Greater Glasgow and Clyde, and Greater Manchester, which has had similar restrictions to the ones now in place in Glasgow, in place for a period. They were due to end earlier this week, but they've now been extended because cases started to go up again. We just can't take our eye off the ball. We can't rest on our laurels here. We have to fight this battle day in and day out to keep it at bay. Alan Smith from Bauer.
Thank you, First Minister. On quarantine, the decision to impose quarantine restrictions on people arriving from Greece, the President of Barhead Travel has spoken to Radio Clyde and called for justification over the move and has questioned why Scotland's policy covers all of Greece, whereas the policy in Wales covers Zante. And just secondly, on the restrictions in Glasgow, we're seeing cases at 53 for Greater Glasgow and Clyde today, down from 86 yesterday. If we continue to see a fall in cases like that in the coming days, is it possible restrictions could be lifted sooner than the planned 2-week review?
On that, I hope we continue to see cases come down, but I would, as I have before, and as I'm sure Jason will jump in to reinforce, we have to be cautious about individual days. When it comes to cases, we have to look more over a 7-day rolling average, because you will get spikes day by day or variations day by day. We need to see how that averages out over a period, and obviously we look at a range of different things in these situations: case numbers, positivity rate of those cases, what proportion of the overall tests are being positive, the cases per 100,000, although that's only one factor. Plus, there's a lot of judgment applied to this based on the analysis of what is driving an outbreak. It is possible, and I hope I gave some sense of this in my initial remarks, that it's possible to look at two different areas where the data looks almost identical, but you might do certain things in one area but not in another because the drivers of transmission are different. In Cooper Angus, we would have seen case numbers and positivity rate quite high in the last couple of weeks, but it was all focused on this discrete outbreak that a ring could be put around. In Glasgow, right now, it's different because it's small, unconnected clusters that needs a different approach. So we have to look at all of these things very carefully and over a period of days in order to try to arrive at the best judgments. Jason might want to say a bit more about that. On Greece, we have to come to our decisions, and other governments have to come to their decisions. The justification, if I use that term, is that, and again it goes back to what I've been saying today, test and protect, as well as trying to break the chains of transmission, gives us a lot of intelligence about where cases are coming from. It can't always tell us where a case has come from, but it gives us a lot of information that allows us to make judgments. And over recent days, we have seen a significant number of positive cases in Scotland that have reported very recent return from Greece. And we have taken a decision on a preventative, precautionary basis to ask people coming back from Greece to quarantine. And we look at countries on a weekly basis. These are not ideal situations, but as we know from February, March, a lot of what drove transmission in the UK were cases coming in from overseas. So it's an important part of how we try to keep it all under as much control as we possibly can. Do you want to say more?
The WHO say, we've said this before from this podium, the WHO say you need 6 things to come out of lockdown. 2 of them are reduce the prevalence and reduce importation. So the answer to both of your questions is kind of the same. Test and Protect, remember, interviews every single positive case personally, asks them where they've been, what they've done, what did they do before they got the symptoms, and then themes that up into themes, frankly, and tells us what that looks like. Is it international travel? Is it indoor hospitality? Is it house gatherings? It would be inappropriate for each of those individual stories to be shared with the country, but when there is a theme, Greece is a theme, and indoor households in Glasgow is a theme. And therefore, the advice we give from that incident management team, wherever it happens to be, up the chain to the First Minister and the Cabinet Secretary to then make proportionate choices for what those themes tell us. So the answer to your questions is exactly the same. It would be lovely if there were a binary moment that the whole country could follow and say, if it tipped here, we'll do this, and if it didn't, we wouldn't. It just doesn't work like that.
Fraser Knight from Global.
Thank you, First Minister. Just actually on the Greece quarantine, when we look at the rate of infection, you're looking at around 14 people per 100,000 in Greece who have got the virus. And then on Tuesday, when you were bringing in the new lockdown measures in Greater Glasgow and Clyde, you'd said West and Bartonshire was looking at 33 per 100,000, in Glasgow 22. On the face of that, statistically, it looks to be more safe to go to Greece and stay in a hotel and go to a bar than it does in Glasgow at the moment. Would you recommend people perhaps don't take a holiday in Glasgow for the next 2 weeks or stay away from the city? And just if I may as well, for the Health Secretary on Home Farm, the court action against to end the registration of Home Farm was dropped by the Care Inspectorate. So can you just kind of explain why then NHS Highland is looking to buy that? I mean, is there more concerns around the way that it was being run, or what's the kind of thinking behind that?
I'll hand over to the Health Secretary, obviously, on that point. Just briefly on your first point, we've given our advice to people in Glasgow City and Western Bartonshire and East Wren, not having people in houses and not going to other people's houses. So that's the advice we've given based on what we think is driving transmission. I perhaps I appreciate I partly cause this because sometimes we do quote figures about cases per 100,000, and I'm not saying they're not important. They're part of a wider, picture that we build up. But cases per 100,000 are not the only thing we look at. And in actual fact, one of the things you've got to be cautious about in terms of the cases per 100,000 figure is that will be influenced by the volume of testing you do. So if a country or a part of a country is testing many more than another, their cases per 100,000 will be higher, but it doesn't necessarily mean their prevalence is greater. So it's one of a number of things we look at. We look domestically at that. We look at test positivity. I don't have yesterday's figures in front of me, but from memory, for example, our positivity rate across Scotland yesterday was 1%. In Greater Glasgow and Clyde, it was 2.2%. So it was double. So we look at that, and then we look at the themes, as Jason said, that Test and Protect draw from all of that information. And we also look, and this is a delicate thing to say, we will look at the risks. Maybe some people, when they're on holiday, they're understandably, as we all do, this is not a criticism of anybody, we all do this, we're maybe not taking as much care because we're on holiday and we're relaxed and we might be, on the beach or going out to nightlife. So we're maybe more at risk in certain areas of getting the virus and bringing it back. So there's a whole basket of things that we have to take account of. And this would be so much easier if it was just a simple statistical formula and you could say, here's the threshold, and when we pass it we do this, and when we don't we do something else. It's not that simple, and it would be a lot easier for those of us taking the decisions if it was, and actually it would be easier for me to communicate it and for all of you to understand it. But it is complicated, and what I'm trying to do is explain the complexity as clearly as I can, and I'm pretty sure I don't always do that as clearly as people would like, but just trying to explain the nuances and the complications around all of this, and that applies in things we do here, but also the decisions we're taking in relation to other countries as well. Jeane.
So on the home farm care home situation, the basis on which the Care Inspectorate could go to court, and this is a very limited basis, is an assessment by them that the situation at that time in the care home was effectively a risk to life and limb. And it goes to court for the suspension of registration and emergency cancellation. In order to ensure that the care doesn't risk life and limb, NHS Highland steps in at that point to provide support and leadership and improvement. As it does that, the grounds, if you like, for the care inspectorate being at court are diminished because there is no longer risk to life and limb of the residents. Cleanliness is improved, PPE is there, staff are supported to do the job that they want to do well, and infection prevention and control standards are raised to the standard that is needed. But that needs to be sustained. And the discussions and considerations that were underway involving the Care Inspector, NHS Highland, me as the Cabinet Secretary for Health on behalf of the Government and HC1 was whether or not that necessary improvement could be sustained by HC1 going forward. And the conclusion that was reached was if NHS Highland stepped away, then there was no guarantee of that. And we're talking about an island population who do not want their loved ones cared for off-island if that can possibly be avoided. So the discussions and the negotiations were begun with my authorisation to see if it was possible for NHS Highland to take over the registration and the running of that care home. And that's the situation that we've now reached. That agreement is there. There's more work to be done to chuppy the staff over and so on and so forth. But that ensures that not only are the standards high, but the staff are supported and the residents of Skye, and most importantly, the elderly residents and their families, can be assured of a long-term stability in care and the quality of support that their loved ones receive.
Shona Duthie from Original 106.
Thank you, First Minister. I have a question for the National Clinical Director. With the cluster linked to Aberdeen pubs now declared over, what have you learned from the way that particular outbreak was dealt with? Is there anything you would do again or anything you would change if we were to see a similar outbreak in the future?
Jason.
I think it reinforces the multi-agency nature of a response, particularly when it's across a large business sector. You couldn't have got to where we've got without the health service, the local authorities, particularly environmental health officers, and the business sector themselves stepping up, doing what they had to do collectively and individually, and the population following the guidance. So it reinforces the two weapons which the First Minister and I have just described as the only weapons we have: test and protect. So that involved the businesses, the local authorities, everybody else gathering around what were the mitigations that should be in place. They inspected, I can't remember the exact number, something like 300 individual premises, spoke to the owners, made sure the mitigations were in place for reopening. And at the same time, we asked the population to behave differently. If the population had ignored that, the cluster wouldn't have gone away. So you need both of those things together, and I think it reinforces how important the collaboration across the sectors is, whether that's Glasgow City, East Wren or Aberdeen City, and the behaviour of us as individuals if we're caught up. So I live in Glasgow City. I have to obey this weekend different rules from those in Edinburgh City. And that becomes really, really important if we're going to be able to release those measures in the weeks to come.
Thanks. Katrine Bussey from PA.
Hello, First Minister. Another question, if I may, on the purchase of the home farm care home on Portree, so maybe better for the Health Secretary. But I just wondered if the previous owners of the care home, HC1, will make a profit from the sale of this, make a profit from the sale of this property to the NHS. And if so, is that not them being rewarded financially for providing a service which the Health Secretary has just said put at risk life and limb?
So I completely understand the question, and these situations are not straightforward. What we have to decide to do is what is necessary for us to do at our own hand through the NHS or as the government in order to do everything that's possible to protect citizens. And how do we sustain that? And secondly, how do we then enter negotiations and discussions with a private company that has its own interests to pursue? I believe that the conclusion of those negotiations have produced not only stability for the residents and security for them and their families, but also the best use of public funds, because to have done anything else would have entered us into a much longer term financial arrangement that would have cost a great deal more, but without the overall control of what happened in that care home sitting in the public sector, i.e. the NHS. So you have to negotiate your way through these, trying to ensure that there is no indication that anyone is being rewarded for not delivering on the standards that are required, but at the same time recognising that there are two sets of interests here that have to be balanced. And my primary purpose is to ensure that residents are safe and that the public funds are used to best effect.
Scott McNabb from the Scotsman.
Thank you, First Minister. If I could just go back to aviation, please. Gordon Dewar of Edinburgh Airport has written to the government today, raising concerns that the aviation and travel industry, as well as rebuilding Scotland's economy, may be difficult, if not impossible, under the current quarantine regime, which is described as a travel ban in all but name. And if we're going to be living with COVID for months and years to come, it's not a sustainable approach. He calls for a dual approach with balanced attention given to both health and prosperity. Are you satisfied at the moment that that balance is being struck, and what's your reaction to his sort of broader comments?
I've not seen Gordon's letter today, so I'll take the opportunity to look at that. I absolutely get where Gordon Dewar and others in the aviation industry are coming from, and I, nothing in what I say should be seen as trying to certainly not criticise, but not even in a sense contradict, because I get it. But equally, I've got a responsibility to try to keep the country safe from a virus, and these balances are not easy to strike, but we have to do it as effectively as possible. It's not fixed in stone. We do want to continue to explore with the aviation industry, and in this instance specifically with airports and airlines, about whether there is a better balance around quarantine. But for the reasons I've already outlined today, so I won't repeat it, we're not satisfied at the moment that simply moving from quarantine to testing would provide enough protection. Quarantine is not foolproof. It doesn't mean that nobody with the virus comes into the country, but we judge that it is a more effective protection than testing for the reasons I've set out. Because if somebody is in the very early stages of the incubation of the virus when they fly into the country, they may well test negative. But once they travel then on and into wherever they're going in the country, they will develop the virus and spread it. So we have to find the most effective ways of doing this. And it's not easy. It's not easy for the industries affected. And there's not easy balances for us to strike. I wish I had the magic wand solutions to all of these things. I can't find the words to tell you how much I wish that I had the magic wand solutions to all of these issues, but I don't. We just have to navigate our way through this. But the one thing I do know from experience early in the year is if we don't keep the virus under control, we make life even harder for the economy and for particular sectors within it. So I'll obviously give attention to Gordon's letter when I get it, and we will continue to have discussions and hopefully, as we move forward, get to better balances that manage to weigh up both the public health and the economic arguments. I've never seen these in competition. I know there are tensions all the time, but if we don't keep the health situation under control, we will damage the economy. And likewise, we know if we don't support the economy, we do more health damage. So we've got to keep them both very much as far as we can in a good equilibrium. Chris Musson from The Sun.
Good afternoon, everyone. Can you tell us how many of the positive cases we've seen in the past 7 days in the areas of concern in the west of Scotland have been linked to house parties specifically. I'm assuming this is information that public health officials have, and I ask this because there's an impression among some that the majority are being punished due to the actions of the few. And just additionally, can I ask, the UK government has said that it's started to roll out 20-minute tests and is aiming for mass population testing by the end of the year using this technology. Have you got a similar aim?
We're working with the UK government on testing. Certainly welcome that commitment. I think there's a lot of work needs to be done to, and there are some pilot initiatives that have been announced today. There's a lot of work that needs to be done to get from here to fulfilling that ambition, but we are absolutely on the same page and want to move in the same direction. So we'll continue to work closely with the UK government. And as we do that, we've got to keep very focused on making sure we have the capacity and the resilience in our current testing arrangements to meet the objectives of our current testing strategy. We have, this was made public a couple of weeks ago, we have already ourselves procured some very quick tests to trial those. So all of us want to get to a position where we're able to do mass population testing, although scientists will tell you when prevalence is low, there are issues around that. In terms of the reliability of testing, but we want to get to that, and we want to get to that as robustly as possible. On the first question, I don't have statistics in front of me right now. What I would say, Jason might want to add to this, remember what he's already said today. Test and Protect interview every single positive case to try to work out where they've been, where they can't always say definitively where somebody got an infection, but there'll be also a process of elimination applied here. And what we know from the analysis we've got so far is that there is not, as there was in Aberdeen, the obvious connections between positive cases and pubs and clubs. What it appears to be is that it is more household transmission. The one point I want to be clear about, though, is that is not just big house parties. There may be an element of that, but it is also about family transmission in smaller household gatherings, where the virus spreads from one household to another, but it may just be an extended family coming together. And that's not about blaming anybody. We all know how that can happen in a domestic setting. So I don't want people to think it is all about house parties. We do have a concern about house parties, which is why we've recently toughened up the enforcement powers that the police have. But I don't want people to have the impression it's just about that. It's about a concern about, let's just think about it in our own lives. When you're in a pub, and this, we've expressed concerns in the past about guidance not being adhered to, but there is guidance that is meant to be in place in pubs of physical distancing and hygiene and, table service staff wearing face coverings to reduce the risks of transmission. It is a more regulated environment. Doesn't always work. It's not foolproof, and sometimes the standards slip. In our own homes, it's a lot harder to have that kind of approach because we're with our loved ones, we're in our own homes, and therefore there are risks of transmission there that are perhaps different and at times a bit greater. And that's what the analysis in the Greater Glasgow and Clyde situation is telling us is driving transmission. Doesn't mean there'll be no cases associated with pubs, but it is a very different situation to the one we faced in Aberdeen. Do you want to add?
Some of this, Chris, is a judgment based on those interviews. So sometimes it's difficult to give you what I know you seek and lots of others seek, that 47 people were in a house cluster and 2 people were in a pub. It doesn't quite work as neatly as that. The interviews do get some of that information, but the ones in the house may have also been in the movies or they might have travelled. So we have to make judgments about what we think those common themes are and then take appropriate action based on those common themes. It's important to underline what the First Minister said. This isn't 3 big house parties with 100 people. Otherwise, we would have acted differently. This is a general transmission inside homes, some of which are bigger than you would hope. Others are just people dropping their guard in relatively small family groups, extended family groups. The only other thing I would add about your first question, your testing question, is it's not quite right to say the UK is rolling out 20-minute testing. The UK is piloting 20-minute testing in some populations, and we are in that UK pilot. We are talking to them, we have people in the room, we have scientists engaged. So if that works, and we hope it does help us with some of the challenges that we've been answering even today, we will be right in the results of that and we'll be able to act appropriately.
Tom Martin from the Daily Express.
Can I just clarify on that, just on the house parties, there was a lot of information there and you were breaking up a little bit. Is it the case that you can't say how significant an element house parties are in this West clusters, in the West situation?
No, what I said, apologies if we were breaking up, is we are concerned about house parties, not just in Greater Glasgow and Clyde, but generally, and we took some specific action to give police more enforcement powers. But it is not the case that in the Greater Glasgow and Clyde situation, it is only house parties and that we think there's, you know, a number of big house parties that are accounting for this. There may be an element of that, but the analysis we've got suggests that it is much more about smaller, perhaps extended family-based transmission with, you know, people just having family over. So that is what that is telling us. But as Jason said, sometimes it can be definitive in individual cases. At other times, Test and Protect is making judgments based on the picture the person has given them and the links between different cases. I suppose the final point I would say, Jason's referred to him being a resident of Glasgow City. I totally get the frustration of this. I live in Glasgow. I was looking forward to seeing my mum and dad at the weekend for the first time, as my mother could probably tell you the exact number of days, but well over a month. I was hoping to see them this weekend. I won't be able to do that because they can't come to my house, and even although they don't live in the affected areas, I can't go to their house. So I'm not immune from living under these restrictions, and I know how difficult it is and I know how frustrating it is. So I share that view, but equally I know how damaging it will be if we don't take the necessary action to try to stem this spread before it becomes worse and we have to impose even stricter restrictions. Tom Martin from the Daily Express. I think we didn't get to you.
Oh, sorry. Sorry, can you hear me now?
Yeah.
Sorry, good afternoon, First Minister. Thank you. Just a couple of questions relating to the situation in the west of Scotland. You talked, obviously, in your opening remarks about this being a targeted approach, but can you just explain why, for example, you're not able to zoom in like you did in the Dumfries and Galloway situation and target specific postcodes? Because these are quite, big, large council areas. So, why is it not possible to be a bit more precise, if you see what I mean? And secondly, as we saw in Aberdeen previously, and it's just picking up from your point you talked about there about frustrations, there might be some people out there thinking, they're being punished or penalised for others' behaviour. Children, for example, will be disappointed at not being able to go around to their pals again. How do you address those concerns?
Nobody's being punished, and I wish we could. I'll come on to the first part of your question in a moment about postcodes, and Jason, I'll hand over to Jason on that as well. But I wish we could say, look, we've got a cluster here that was caused definitively by this person. Now, I'm not saying we'd name them, but we'll put them under restrictions. But we can't. That's not how a virus operates. Once it goes from one person to another, the risk is it spreads in all sorts of different ways. So, unfortunately, it is population-based measures we have to apply to stop that happening. And it's hugely frustrating and it's hugely disappointing, and I feel for everybody in Glasgow, where I live, in East Wren, West Dunbartonshire, who having to cancel plans this weekend. I'm making the point, I'm not immune from that. I'm in the same position. But the alternative is we don't take action and this runs out of control and we're in an even worse position, and we perhaps see more people getting seriously ill and dying. So I'm afraid we're in an accelerating global pandemic and life's not ideal, and we try to be as targeted as possible. And because we do have more information than we had back at the earlier part of the year, we can be more targeted. Now, postcodes, we will try to be as targeted as possible. That can often be more difficult in a city. So in Aberdeen, we couldn't limit it to postcodes because in a city, and this is certainly true in Glasgow, you will have people travelling between different postcode areas. The interlinking of people and travel and activity makes it a lot harder to just focus in that narrow geographic basis. But, you know, we do try to narrow geographically as much as possible. And I know we've included the whole of Glasgow City, but we haven't included the whole of the Greater Glasgow and Clyde Health Board area. We've tried to narrow it within that, and we will always look to narrow it. But we also have to recognise how people live their lives and take account of that as well.
Feels like a long time ago, that Dumfries and Galloway outbreak you reference. If you remember, though, small numbers related to travel across the border, particularly related to employees at the Carlisle Hospital, and therefore it was easier to be specific, not to punish, and we're not punishing in the 3 local authorities in the west of Scotland now. The west of Scotland outbreak looks very different from that, and we've talked a few times today about the nature of the Aberdeen outbreak versus the Cooper Angus outbreak, now versus the west of Scotland outbreak. So the interventions have to be appropriate to what we find. And Dumfries and Galloway was appropriate to go down to postcodes, and if it were appropriate in Glasgow City, if there were a specific thing, a factory, a workplace in some way, then the public health advice would be, let's do something specific in that postcode. I'm afraid this one doesn't allow us to do that.
Libby Brooks from The Guardian.
Hello, First Minister. This is really a follow-up from Chris's question, and it's really useful to have that extra detail because it was difficult to get it from the local health board yesterday. And I know that you've already been asked this in regards to data on cases per 100,000, but it is just really, to emphasise, really useful to have the information that is underpinning these decisions, just in order to report what's happening as accurately as possible. As a Glasgow resident myself, it does feel that these interventions are sort of really highly targeted, as you said. Can you tell us just any more about perhaps the demographics involved, the sorts of behaviours involved, even if there's concerns that people feel that they are actually safer and less at risk when they're at home, which obviously, you know, as you discussed before, is not the case, given that in pubs and restaurants you have sort of far more sort of restrictions and so on in place.
I'll try to. I'll hand over to Jason as well. Can I make the obvious point that this outbreak in the Greater Glasgow and Clyde area is still ongoing, so it's still under, you know, ongoing investigation. The test and protect work is continuing, so the information around cases, causes, sources, demographics, that is still developing. I don't have statistics I can share with you right now, but we will try to give people as full a picture as it develops as we possibly can. What we're trying to do right now is give a sense of the broad themes that are emerging, that are then guiding the decisions. But one of the issues here is that it is more disparate than some of the other outbreaks that we have been dealing with. You know, I keep going back to Cooper Angus. All of the cases there pretty much were people who worked in a factory and their household contacts. So you could just put a ring around them, and that was done effectively. Here it seems to be more spread out across a number of smaller unconnected clusters, and that makes it more difficult to do it in that kind of way. We have to do it in the way that we have done. The other thing I would say before handing over to Jason about we publish, as you see, we publish as much data as we can, and I'm always open to trying to publish more data, and I think as Test and Protect continues to develop, we will always want to look at how much more of what they are gathering we can put into the public domain. The point I'm trying to get across here about these decisions about restrictions is that they are absolutely informed by data, but they also involve a lot of interpretation and judgment. So you could look at 2 areas where the data looks pretty much identical, but you do very, very different things because what is driving the data is different. And I think that's what's difficult for all of us to get our heads around. This is not just, you know, X cases per 100,000 or another statistic. It's a mixture of all of that, and then a lot of analysis by experts who try to then make judgments about what's driving it and therefore what's going to be most effective in trying to stop it.
The only thing I would add, Libby, is it's ongoing, so we don't know, and we haven't reached the end of this particular outbreak, but it's not very young children and it's not very elderly people, it's families and young adults. I'm not sure where the young adult age group range goes, but in general terms, it's mixed households by gender and it's mixed age groups, but not the very young and not the very old. And that's a good thing because we know that the very old are the most vulnerable to this particular virus and the illness it unfortunately causes. One of the reasons for the restrictions is to try and protect that very vulnerable group as much as we possibly can. And you've seen hospital admissions, ICU admissions go down, and we really, really don't want to see that go in the opposite direction.
There's one other point I've been meaning to make, actually, and the point you made, Libby, about it feeling as a resident quite targeted gives me the opportunity to do it, because I've had people asking me in the last couple of days, why did you not do pubs instead of the household restrictions? And the point I'm trying to get across is that given what we know about the drivers of transmission so far, it was never an option not to do the household restriction bit of it. That was always going to have to be necessary. The question then became, and we discussed this at the resilience meeting the other night, did you also do pubs? It was never an option to do pubs instead of household restrictions. And the judgment that we've made so far is because there is not the evidence yet, this may change, that it has been driven particularly from hospitality, and also because we know there is guidance that is intended to minimise restrictions in transmission in hospitality. The judgment and the advice at that point was that that wouldn't have been a proportionate thing to do. But I just want people to understand it was never an option in this case to do pubs instead of household. Household, because of what we know, was always going to be necessary to stem this flow. Tom Peterkin from the P&J.
Good afternoon, First Minister. I'd like to ask a couple of things, if I may. Firstly, the co-leader of Aberdeen Council, Douglas Lumsden, has suggested that the Aberdeen lockdown was politically motivated on the basis that it was more stringent than the one currently in SNP Glasgow. I wondered what your reaction to that was. And secondly, there seems to be a cluster in Granton and Spey linked to the Millers of Speyside slaughterhouse. Are you looking at tightening restrictions there? Can we expect a lockdown there, or is that something you can rule out?
I'll come on to that, and perhaps Jeane wants to talk, or Jeane and Jason, on Granton and Spey, which is a cluster that is being approached in a particular way given the nature of it. On the Douglas Lumsden comments, I don't know, it just depresses me actually, for a couple of reasons. I hope I've given people, it's very complicated, I know that, but I hope I've given people a sense of what drives these decisions. And we look at what's driving an outbreak in Aberdeen. It was very much pubs. In Glasgow, it's household, and that basically leads to the restrictions that unfortunately we have to put on. I don't know, I've got to the point where I think if there's still people out there who are prepared to think I'm taking these decisions from some kind of crazy party political point of view, then they're always going to believe the worst of me, and there's probably nothing I can do to convince them. But I hope that kind of view is the minority, and I hope the majority of reasonable people, whether you agree with my politics or not, and whether you agree with the decisions I'm arriving at or not, do get a sense that we're trying to take them for the right reasons. The only other point I would make, and just in point of fact, is that when we first, I disagreed later on, but when we first took the decisions on the Aberdeen lockdown restrictions, Douglas Lumsden was part of that decision in the resilience discussion that led to it. So, I'm not going to say any more about that because I think it's just ridiculous. And Jeane, do you want to say anything about Granton and Spey?
So the situation in Granton and Spey is, as you described, in part, there is a connection to a local company there, Millers. The IMT is actively engaging, so the local incident management team, local health protection team and NHS Highland, and of course the local authority are actively engaging with that company, and Test and Protect is right up the middle of that. There may be some other local connections, but they're still investigating this and getting the cases through and looking to see if there are any, if, as Jason has described it before, any themes there that require additional action. But the information that I have as of this morning is that the incident management team will meet later on today and take a view then as to whether there is more that needs to be done or whether they feel that they have put the necessary ring around this outbreak of cases at this point.
Thanks. Alistair Grant from the Herald.
Hi there, thanks very much. Just to go back to Katrina's question earlier on, just about home farm care home. I just wasn't very clear in the answer given by the Health Secretary. Did HC1 profit from the sale? How much was the total purchase cost?
So my apologies if you didn't hear when I made the announcement. The total cost is 900,000. That is the price that NHS Highland has paid, but the money has gone from Scottish Government so that NHS Highland's own funds are not used for this purpose. Whether or not HC1 profited from it or not, I don't have HC1's accounts in front of me. I don't have their balance sheets. They're a group, as you know. This is one care home in their group. What I do know is that with our senior finance officials and with NHS Highland, we worked very hard on those negotiations to get the best possible price, remembering that what we are aiming to do is secure a sustainable future for that important care home on the island of Skye, and make sure that the residents there are cared for and looked after well.
Simon Johnson from the Telegraph.
Good afternoon, everyone. I spoke to Professor Linda Bald yesterday of Edinburgh University regarding the Glasgow restrictions being imposed, and she was very supportive of those, said they were proportionate and they were targeted. However, she said that your elimination strategy is not going well, given the rise in cases. And I asked her as well whether Scotland has now adopted a whack-a-mole tactic in the same way that England and many countries on the continent have. And she said, absolutely. Do you think that's a fair assessment of where we are at the moment?
Well, I think a great deal of Linda Bald, actually. I think she's, I always pay attention to her comments because I think she talks a huge amount of sense and is obviously an expert. I'm not a public health expert. I just know what I'm trying to do. Advised by and guided by public health experts, which is to keep this virus as low as possible and eliminate it if we can. Elimination is not eradication, it's not a moment in time. So I will always try to act in a way that gets to that elimination strategy as possible. But when outbreaks, as they unfortunately will occur, then we'll try to hit them hard and stop them as well. So I don't see it, and maybe this is just because I'm a First Minister, not a public health expert. I don't see it as an either or. Elimination is my objective if we can, but I know the challenges that come with that. So when we need to whack something, we will do that too. It's not either or. I just want to keep this virus at as low a level as possible because I know that's good for the country in a health and economic sense, but also means test and protect is able to do that job more effectively, and that's the kind of simple way I take it. It's why I've always thought, why would anybody not want an elimination strategy? Because you want to get it as low as possible in order that when you do have outbreaks, you can get a grip of them much more quickly. Mark McLaughlin from the Times.
Good afternoon, First Minister. I'd like to ask about the economy. Scotland's GDP returned to pre-recession levels within 4 years of the 2008 financial crash. Yesterday, the Deputy First Minister said Scotland won't make a full recovery from coronavirus unless Scotland becomes independent. What's so unique about this recession that it can't be fixed with the powers that you have?
We'll do everything we can with the powers we have at any point to fix the economic damage of coronavirus, and the starting point of that is to keep coronavirus under control. I think John makes the obvious point that I think for any government, the more economic levers you have, the more effective you can be at doing that. Right now, the biggest economic, there's lots of economic concerns right now, but one of the big economic concerns I have is the withdrawal of the furlough scheme, and I hope the UK government changes tack on that. I can't unilaterally do that, which if Scotland was an independent country, obviously we'd be in a different position. So these are just the obvious points. I'm not particularly trying to make them standing here in a political or constitutional sense. They're just obvious statements. But right now, I'm just focused on using whatever levers I have at any given time to tackle COVID, hopefully beat COVID, and repair the economy as quickly as we possibly can. Rachel Watson from the Daily Mail.
Thank you, First Minister. I just wanted to go back on the quick or rapid result testing. I know that the Scottish Government are part of this trial, as the National Clinical Director said, but will there be any trials of this in Scotland? And what do you hope testing like this could achieve? Do you think this could be used to help get offices open again, crowds back at sports, and just give more normality? Is that what kind of express testing would allow to happen?
I'll let And answer this substantively. I want to see testing, science, all of it, as quickly as possible, play as big a role as possible to end this crisis and get us all back to normal. I think if you cast your mind back to an earlier stage when we were all kind of thinking antibody testing was going to be the great big panacea that solved all of this, and partly because of what we learned about the virus and what's still unknown about the virus, that hasn't been the case as quickly. So I think we've got to be optimistic and ambitious about testing, but we've also got to be realistic and make sure that trials are done properly and we learn, what the efficacy is and what it isn't. And in the meantime, focus on what we do know works, which is the test we've got just now, albeit any test has got limitations, and make sure that we are building and protecting the capacity to do that. But we are involved in discussions around these pilots. We want to know the learning. As I said earlier, we've already taken some procurement decisions ourselves to access some potential 12-minute tests. So we will absolutely want to put ourselves at the leading edge of this. But we've also got to make sure that we're doing it properly and we're not giving people false hope about what things can do before we actually know that it is deliverable.
This particular pilot and prototype is going to be Salford and I think Southampton. Southampton have been involved in some early trials of mass city testing up to this point. I don't think this test will be the one, but in a slightly fictional world thinking forward, if you had a non-invasive, fast home test, then you can imagine what that might be able to do to you. That if it's specific, then that may be able to tell you that today you are virus-free, and you could do it again tomorrow and you'd be virus-free. But think of the logistics of that. Just in our country, that is enormous. And the whole world will want that. So there is something in it for certain. But the logistics and the science are behind. So we have to get to a point where the combination of all these things go together. So prototyping whether the test works is exactly the right point in time to do that. And if we can do that in a non-invasive way quickly, imagine a pregnancy test from saliva. You would get a line in your test to tell you you're positive or negative today. You would then be told how to behave appropriately for that test result. Do it again tomorrow, do it again the next day. But that presently, you might not write it up like this, that feels like fiction.
And lastly today, Tom Magner from Carers World Radio.
Thank you very much indeed, First Minister. Viewers are welcoming the review you've announced into a national social care service for Scotland. But isn't it fundamentally flawed if it doesn't focus on a combined national health and social care service? After all, our viewers are saying it's a serious absence of joined-up thinking that's caused years of problems. So maybe the example of NHS Highland taking over the home farm care home on Skye is a way both to involve the local community and get joined up health and social care working straight away, rather than waiting perhaps months for a report that may ultimately miss the real point.
Of course, we have already taken significant steps around the integration of health and social care, and this review is looking at the further reform we think we need in the care service. But I'll hand over to the Health Secretary to answer more substantively.
So just to follow up on the First Minister's point there, and Tom, and I hope this is helpful, but earlier this morning I was involved in about an hour's worth of discussion looking at how we remobilise our primary community and social care services in Scotland as a big focus, a big priority about how we bring these things together. And that has involved not only practitioners in primary and community care, but also local authority partners, our health and social care partners and their lead officers, all working out what is everything that you need to wrap around an individual so that they can live as independently as they want and as well as they can. So that has been a core focus for this government for some time, and the integration of health and social care, of course, played a big part in moving us along that path. And our experience of the pandemic has had opportunities for us to do that work better, and now to keep a hold of that as we look to remobilise those services. The independent review on adult social care in Scotland will look at that learning, and it will also look across the whole adult social care sector and decide what it thinks is the best way to have that national service who should deliver it, how should it be funded, how should it be regulated, and that inevitably links right in to our NHS. And the two work hand in hand. So it's not an either or, and I don't think we'll be doing the one without being very cognizant of the other. As the review group has already started its work, it had its first meeting yesterday, it will be reaching out to hear the views of those who use the service, the user-led panel that we had set up and have been working for the past 2 years, as well as practitioners and all the other stakeholders involved. And it will give us some serious options and probably some difficult choices when it reports in the early part of next year.
Thanks, Tom. That concludes the questions today. Thanks for joining us, and my thanks to the journalists, to Jason, Jeane, and to Robert for the BSL interpretation today. Barring unforeseen developments, we will not do a briefing tomorrow at 12:15. Our plan is that we will be back with you on Monday. So let me just leave you with a plea to follow all of the advice. If you live in Glasgow City, West Dunbartonshire or East Renfrewshire, please do not visit other people's houses and do not have people in your house. I know how difficult that is, as we've reflected on over the course of today's briefing. That affects me this weekend, it affects Jason, it affects Jeane as well. We are all three of us Glasgow City residents, so we are not asking you to do anything that doesn't impact equally on us too. But this is a really important measure to try at an early stage to stop the virus spreading more rapidly across these areas, because if it does that, we may have to look at more severe restrictions in future. So I appeal to everybody in these areas to follow all of that advice. If you're in these areas and are contacted by Test and Protect as well, the advice is slightly different. If somebody is identified as a close contact of a positive case, then in these three areas, the whole household of that close contact will be asked to isolate for a period. Again, very difficult, but please follow that advice. And the three local authorities, of course, have been making sure that they have welfare and support arrangements in place. In these three areas and in other areas, if you are out and about in other ways, please follow all of the facts advice. Face coverings, avoid crowded places, clean your hands and hard surfaces, 2 metres distancing, and self-isolate and get tested if you have symptoms. Test and Protect is doing a great job, and I want to thank everybody who is associated with that. But it is, to go back to my earlier point, it's our second line of defence. Me, Jeane, Jason, every single citizen of Scotland, collectively we're the first line of defence. So if we follow all of these rules, we minimise the chances of the virus taking hold, and we minimise the need for Test and Protect to come in and do its work. So with all of that advice and restrictions, please still try to have a good weekend, and thank you for continuing to do all of the right things, and please spread the message as far and wide as you possibly can. So hopefully I will see you again, not tomorrow, but on Monday. Thanks for joining us meantime.